Welcome to Books for Success. Today, we're delving into the wisdom within Cognitive Behavioral Therapy by Olivia Telford. Cognitive behavioral therapy explores a range of mental health topics, including managing anxiety, overcoming guilt, handling addiction, and integrating mindfulness into your daily life. Filled with practical tips, exercises, and real-world examples, it offers a user-friendly approach to enhancing mental well-being. Who's it for? Anyone who has experienced depression or anxiety. People interested in mental health disorders and solutions. Psychology students exploring therapeutic techniques. Before we begin, subscribe and ring the bell for notifications if you want to keep receiving the knowledge of book summaries about health, wealth, love, psychology, and much more. Don't be shy about dropping your book suggestions for us to summarize. Also, you can use this video as an audiobook summary. Let's grow and succeed together. What's in it for me? Get a better understanding of one of the most reliable mental health treatments. If you've ever dealt with the symptoms of depression or anxiety, you know how debilitating it can be. It's like all the good things about life are being kept just out of reach, and no matter how hard you try, you can't seem to break free from the darkness you found yourself in. Practitioners of cognitive behavioral therapy, also known as CBT, focus on identifying and then challenging the negative thought and behavior patterns that keep us stuck in debilitating periods of low or depressed mood and anxiety. While it can feel like there's no way out, or that we're not worthy of happiness or a good life, CBT can show us that this is simply not the case. In the sections ahead, we'll run through the basics of CBT and learn a few techniques that you can start using today. As useful as these techniques can be, if you believe you're clinically depressed or trying to cope with chronic anxiety, the best advice is to reach out to a professional therapist, counselor, or psychologist who can guide you to better mental health. An introduction to CBT. Let's start with a basic question. What is cognitive behavioral therapy? Commonly known as CBT, it's a psychological intervention or treatment that can be applied to a range of problematic conditions, disorders, and mental health issues. No matter what you apply it to, at its core, CBT centers on the impact of the stories we tell ourselves and how they shape our thoughts, emotional responses, and behavior. The treatment recognizes that sometimes the stories we tell ourselves, including the core beliefs we hold about ourselves and the world, may be inaccurate or be detrimental to us in some way. These beliefs can lead to behavior and thinking that can cause any number of problems. CBT comes in a number of flavors, so to speak. One of the earliest, dating back to 1955, is the ABC model, and it explains the basic principles rather concisely. A stands for activating external events, B stands for beliefs, and C stands for consequences, or resulting behaviors. For example, an outside event happens, and how you react to it depends on what you believe and the kind of story you tell yourself. There are many factors that determine our beliefs. They include genetics, which play a role in determining our personality, as well as our upbringing and the environment we live in. These factors can lead us to interpreting events in a way that may not reflect reality, particularly when it involves someone or something we care deeply about. To put it simply, these factors can work together to create a distorted worldview. Not only that, negative stories and thought patterns can lead to a cycle of thinking that acts like a trap, one that can seem impossible to escape from. It can result in depression, anxiety, stress, insomnia, obsessive-compulsive behaviors, as well as harmful behaviors that are associated with addiction, jealousy, and procrastination. Fortunately, by identifying and questioning these patterns, CBT can help with all of these issues. Let's take a look at how it can be applied to depression. The roots of depression are often tied to what therapists refer to as our self-schema. A schema is a set of beliefs and expectations about a person, thing, or scenario. Everyone possesses schemas about various aspects of life, and we all possess self-schemas, which influence the perceptions and beliefs we have about ourselves. Negative self-schemas can lead to the belief that we're hopeless failures and to demoralizing thoughts such as, "What's the point of trying?" If someone thinks poorly of themselves, it becomes challenging to appreciate achievements and enjoy relationships, which in turn creates a perpetual cycle of self-doubt. This can lead to depression, isolation, and loneliness. This cycle of negativity falls under the category of faulty processing and logical errors. Logical errors in the field of mental health are self-defeating thought patterns that keep people trapped in an unhealthy state of mind. The solution is known as cognitive restructuring. This core technique aims to help you process thoughts in a balanced, rational way without denying or suppressing them. Cognitive restructuring involves 3 key steps: identifying unhelpful thoughts, weighing the evidence for and against those thoughts, and generating a rational, more helpful alternative. For example, if someone breaks up with you, it can lead to thoughts that you're unlovable and will end up being alone forever. But if you stop to think about the evidence against this thought, you'll see a number of reasons. You might recognize that you've had many friends over the years and that this wasn't your first relationship. This should tell you that people enjoy your company. There's also the fact that people usually date for years before finding the right partner, and that not everyone is a good match for you. This is just one example of how CBT works. Everyone has negative and disruptive thoughts from time to time. The point of CBT isn't to suppress these thoughts but rather to identify them when they occur, re-examine them, and prevent them from leading you down the wrong path. Anxiety and exposure therapy. Anxiety is a term that can be difficult to talk about clearly. Part of the reason for this is that experiencing anxiety from time to time is a normal human response to a perceived threat. It's something we all feel. More than that, when anxiety becomes more severe, there are many different kinds of it, including panic disorders, generalized anxiety disorder, and social anxiety disorder. Panic disorder is a condition characterized by recurrent panic attacks, involving sudden and intense symptoms such as sweating, trembling, dizziness, heart palpitations, and racing thoughts. Generalized anxiety disorder, also known as GAD, is a condition where individuals worry about a wide range of events, finding it difficult to relax even after one concern is resolved. Social anxiety disorder, or SAD, is much like it sounds, a fear of social situations, leading to anxiety about parties, work, meeting new people, and engaging in small talk. Isolated moments of anxiety are natural, and can even be helpful in motivating us to do something. But, as you can see, anxiety can also take over our lives and keep us from doing healthy activities. Cognitive restructuring can be a valuable tool in managing and alleviating anxiety. Broken down simply, this means recognizing unhelpful thoughts, weighing the evidence for and against those thoughts, and generating a rational, more helpful alternative. Thoughtful questioning is a great method to use when approaching these steps. For example, you can ask yourself, if my best friend was experiencing this kind of anxiety, what advice would I give them? Oddly enough, we're often more sympathetic and clear-headed when thinking of others. You can also identify anxious thoughts like, I can't cope with this, and try to replace them with more accurate thoughts like, I've had panic attacks before, and things turned out all right in the end. The goal is to shift perspective and cultivate a more rational and constructive mindset. Exposure therapy is another effective tool in the CBT toolbox. This is a way of confronting fears in a gradual, systematic, and empowering way. The process involves identifying specific anxiety-inducing situations, creating a hierarchy of fear starting with the least frightening, scheduling exposures, and consistently facing these situations until the fear diminishes. Exposure therapy is an effective and proven way to diminish anxiety and help you to regain control of your life, but it must be conducted under the guidance of a mental health professional. Exposure therapy can also help with obsessive-compulsive disorder, also known as OCD. This condition is characterized by intrusive, often disturbing, thoughts that prompt compulsive behavior, such as repeating certain phrases or rituals. It may, but doesn't have to, involve fears of contamination and feeling compelled to wash your hands a certain number of times after touching something that seems unclean. Again, it's important to note that we all have intrusive thoughts occasionally. So trying to suppress and avoid intrusive thoughts altogether is not an effective solution. What can work well is exposure and response prevention, or ERP. The point of ERP is to encourage individuals to allow obsessive thoughts to surface without engaging in compulsive behaviors, thereby breaking the cycle of obsession, anxiety, and compulsion. ERP must be done under the guidance of a mental health professional. It works not by avoiding your triggers, but rather anticipating them and committing yourself to resisting your resulting urges. This takes dedication, but on the plus side it can work wonders. At first, once triggered, you'll likely need to sit with your feelings of anxiety for around 20 minutes. But after that, you'll feel the anxiety levels reduce. There can even be an enjoyable sense of triumph when you outlast your anxieties. And with repeated exposure and repeated practice, you'll find that the strength of your compulsions will diminish. ERP isn't easy, but it has definite rewards. Regret, guilt, and addiction. Life is a bumpy road, and one of the eternal truths is that everyone makes mistakes. As a result, no one goes through life without causing others some emotional pain along the way. It's to be expected that we all feel the pangs of guilt and regret from time to time. But when these feelings become severe and stay around for prolonged periods of time, they can start to significantly reduce your quality of life. Fortunately, CBT can help you to break free from these chains as well. Once again, the principle is about identifying and challenging the faulty story you're telling yourself. If you're quick to tell yourself, "This is entirely my fault," every time something goes wrong, you can now begin to question this illogical assumption. The truth is, more often than not, you aren't responsible for everything. In most situations, there are a number of factors involved over which you have no control. But even if you are entirely responsible for something that went wrong, that doesn't mean you are sentenced to carry guilt and regret with you for the rest of your life. This is not healthy, and no one benefits from it. If you cheated on your partner, and this resulted in a breakup, it's unlikely that your ex would realistically want you to carry that guilt and regret with you for the rest of your life. Guilt serves a purpose. It lets you know that you've crossed a line when it comes to your morals and values. But it loses its usefulness when you continue to carry it with you day after day. When this happens, guilt and regret can become a crutch. When you think that you're a bad person who doesn't deserve anything good in life, guilt becomes an excuse not to grow, move on, and learn from your mistakes. Understanding the purpose of your feelings is the first step in moving on. Make amends and apologize for any role you've played, but don't expect closure. Whether or not someone accepts your apology isn't within your control. Learn from what happened and commit yourself to not repeating the mistake. This is how guilt and regret are useful. So the next time these feelings emerge, question them. If they no longer serve a purpose, you can begin to let go and break free from their hold on you. Addiction is another disorder that can be extremely difficult to free yourself from. We tend to think of addiction in terms of drugs and alcohol, but in reality we can become addicted to anything that comes with a feeling of pleasure or reward, such as gambling, work, shopping, or using the apps on your phone. Signs of addiction include feelings of withdrawal when you try to stop the behavior, losing interest in hobbies you used to enjoy, feelings of shame, and a disinterest in your appearance. CBT can help treat addiction through a structured program that mirrors the steps of cognitive restructuring we've seen in previous sections. In this case, there are 4 stages: assessment, behavioral change, cognitive change, and relapse prevention. The assessment stage is made up of 5 W's, which encourages individuals to reflect on when, where, why, with whom, and what happens during their addictive behaviors. Are there certain scenarios that trigger your cravings? Are there certain people in your life that normalize your behavior? In the behavioral change stage, you use this information to better structure your life to avoid these situations and replace them with activities that make you feel better about yourself. During the cognitive change stage, you start challenging unhelpful beliefs, like, "I am helpless against my cravings," or, "If I relapse, it means that all the previous work I've done on managing my addiction was meaningless." It's important to recognize these false beliefs and replace them with factual thoughts, such as, "Yes, it's difficult to overcome addiction, but people do it every day. While relapse is also common, it doesn't erase your progress." Positive self-talk is important in the relapse prevention stage. It's also important to surround yourself with the right people, those who don't tempt your addictive impulses or make you feel bad. Remember, true friends are the ones who want the best for you. Therapeutic mindfulness. In this last section, we'll leave you with a couple of techniques that illustrate the growing field of mindfulness-based cognitive therapy, or MBCT. In many ways, MBCT complements the work done in traditional cognitive behavioral therapy, but there are some significant differences. The primary difference is that MBCT isn't centered on challenging and restructuring unwanted thoughts. Rather, it's about accepting these thoughts with the aim of letting them pass by in a peaceful manner. Moreover, MBCT is by and large a preventative technique. It's used to keep people from becoming depressed or anxious, while CBT is used to treat people who are already dealing with mental health issues. To put it another way, CBT is about taking action to break harmful cycles of faulty processing and compulsive behavior. MBCT is about being. It's about paying attention to the present moment in a way that keeps you from obsessing over the past or the future. This is called being in a mindful state, and it's proven to create a more calm, safe, and peaceful well-being. Here are a couple of simple yet effective MBCT techniques that involve everyday activities. Let's start with a mindful eating exercise. Take a small piece of food, like a piece of dried fruit. Resist the automatic urge to immediately put it in your mouth. Take a moment to simply hold it. Notice how it feels against your skin. How would you describe its texture and color? What does it smell like? Does it make your mouth water? Now put the food in your mouth, but don't start chewing. Hold it on your tongue. Roll it around. What does it taste like? Salty? Sweet? Are there layers to the flavor? Is it dry or juicy? After a few moments, you can start to chew. As you do, continue to observe and consider the flavor and texture of the food. Finally, when you swallow, feel it moving down your throat and into your stomach. Repeat this exercise at the start of your next meal. When you take a mindful first bite, you're likely to slow down and enjoy your meal more. You'll taste more as you savor each bite and notice the different flavors of each ingredient. You can do a similar exercise when you're walking. Find a calm and green space to walk around, if possible. Use all your senses as you take each step. What does the ground feel like under your foot? Is it hard concrete? Uneven stones? Soft soil? What sounds do you hear? What color is the sky? Are there any smells in the air? What does the air feel like when you breathe it in? By making these kinds of exercises a regular part of your daily routine, you can effectively reduce your engagement with anxious or obsessive thoughts that can lead to compulsive, unhealthy behavior. Rest assured that no one, not even seasoned practitioners of mindfulness, live without unwanted thoughts. But with both mindfulness-based cognitive therapy and cognitive behavioral therapy, you have excellent tools to calm your mind and better manage unhealthy or unwanted thoughts when they arise. Final words. Cognitive behavioral therapy, or CBT, contains strategies designed to navigate self-criticism and cultivate self-compassion. Through the key technique of cognitive restructuring, the treatment guides people toward recognizing and challenging faulty logic and unrealistic beliefs that lead to depression, anxiety, guilt, and regret. CBT can also help people overcome addiction by providing a structured program including assessment, behavioral change, cognitive change, and relapse prevention. Meanwhile, mindfulness-based cognitive therapy can be used as a preventative technique to keep the mind focused on the present and cultivate a less resistant and more accepting approach to intrusive and negative thoughts. Thanks for being part of our insightful voyage. If our summary piqued your interest, we encourage you to dive into the complete book for a deeper understanding. Don't forget to like this video, subscribe for more content if you're new here, and share it with others who might find it valuable. Keep on reading, discovering, and advancing until our next adventure.